it's perfect because Jax admitted to me that she does this, and she didn't even know. Gen Z calls them tweakments. They call it, it's a plastic surgery quote unquote trend, but really, it's just you get tweaked to look natural. So the thing with plastic surgery was there was a time when you got an augmentation done, whether it was your nose or your butt or your boobs or whatever it was that you wanted to get done, or you got your skin tightened or whatever. And very little of it was to make you look more natural. It was to make you look more like an ideal.
Yes.
Right?
Yeah.
And so what happened was a lot of people, first off, the tools they had 30 years ago versus what they have now were very different.
Yeah. Procedurally, it's a lot different. Yeah.
And so what happened was a bunch of people started looking the same. They all had the same lips. They all had the same everything.
Yeah.
Right?
Yeah. There was a certain look.
Now you can get kind of whatever look you want, which I think was the point in the first place.
Yeah.
And so there was a content creator from Australia. She said, here's an untouched face of a 27-year-old. And then she said, swipe to the next photo. And then she had 8 different procedures. She said, so this is what really happens, which I respect, where she's like, so she said, Botox in her forehead, Trentinin and antibiotics to treat acne. I don't know what Trentinin is, but I'm assuming it's an antibiotic. Masseter Botox for jaw slimming, 2 non-surgical rhinoplasties. I don't know how that works. I don't even know. How do you have a non-surgical rhinoplasty?
Because rhinoplasty is nose job, right?
Yeah.
Yeah. I don't know how you would do that. Maybe
it's like a syringe that like they put some in here and then they don't have to, it's non-invasive.
Oh, so Brewster Steph, there's like a syringe situation.
A syringe
I wonder how
surgery.
big that syringe is. You think? Imagine how big that needle would be.
I don't want to think about it.
That would be huge. I don't know if you got a thing against needles, but yeah. Anyway, so yeah, 2 non-surgical rhinoplasties, a brow lift, a lip flip.
Yes.
What is a lip flip?
Okay, so I don't know exactly how it works, but I have quite a few friends who've done it, and it looks fantastic. It's just to give you a little bit of an upper lip. I think it's just like
So you pucker a little bit?
You pucker a little bit. It gives you just, the girlies with no top lips, like myself, like I've looked into a lip flip. I'd be into it. But my friends who've had it done for the first little while, they're like, I can't feel the straw that I have in my mouth, or I can't, like they feel like they're.
Is it done with Botox?
I don't know exactly.
It's filler just right here.
Oh, it's filler in the.
Producer Stephanie knows what's up.
Tweakment expert, producer Steph here.
It's like, like it looks completely natural, but they're like, I know I'm talking weird, and they aren't at all, and it goes away after a little bit. But a little lip flip. Flippy doodle. Yeah, let's go. Yeah.
And then of course she has LED masks, and I don't know what LED masks do, but I see them everywhere.
Oh, get an LED mask. You don't have it. Natalie doesn't have one?
No.
Okay, they're there's a couple of different ones, but you can get like the red light ones, and then there's like a whole like circuit that you can do.
Where you look like your Saw or something like that, right? Just
Saw.
What is the point? What does it do?
It like helps with your producer Steph. Yeah.
Fine lines, acne.
Fine lines, acne, and dark spots. We got to get producer stuff in mind.
You know what? We're gonna get
plastic surgery corner here.
Plastic surgery corner. We're gonna get her a mic next week.
Yeah, there you go.
The only thing we're ever gonna talk about again is plastic surgery. This whole show.
Yeah.
I love a little bit of Botox. Okay.
Yeah. Because you were saying that
I had it done on Friday.
You got juiced up on Friday.
So what'd you get done? I got a little bobo on Friday.
Yeah. What'd you get?
I get the top. I get my forehead done, and then I get a little bit right here. And they always ask, like, do you want your crow's feet done? And I'm like, no, because I like them, because it shows how think it shows how much I've smiled.
Yeah.
But how's it setting in? Can I?
No, you look good.
Do I look?
Yeah, your forehead looks flat. Looks like.
Are my eyebrows moving? Okay.
Yeah, your eyebrows.
There we go.
move.
Yeah.
No, you're good.
Yeah,
you're good. So it's not enough that it freezes your face.
No, and I don't want it to fully freeze my face, but I will say, because I only started getting Botox last year, and it was when we started doing this, because I had to sit here and like edit myself, right? So it was a lot looking at your face that much, right?
Imagine.
And we've been on camera for years, but and the second I got Botox, I thought, I know exactly why people get Botox.
I get it. Okay.
I wear glasses, so I'm constantly like this, so I have the fine lines. So I'm just trying to make sure that they don't hang out around with me a lot, you know?
Okay. See, I get Botox too, but I get it for health reasons. So
in your armpits.
I get in my armpits because I'm a sweaty boy. So if you have hyperhidrosis, which I do, I'm pretty sure, it means that like when you're a teenager, you just start to sweat uncontrollably. I can remember in grade 8, I had to stop wearing gray. because it would because you know what gray looks like when it's wet.
Oh yeah.
So I used to bring an extra t-shirt to school so I could change at like lunch.
My little damn fellow.
Yeah, it was crazy.
No.
And like I would be in class and I'd be like writing exams and I'd be feeling the sweat dripping down the side of my body. Like that was how intense it was.
God.
And so I tried many different things throughout like my late teens, early 20s. There was this stuff and I forget what it's called, but it smells like how disinfected in a hospital smells.
Oh God.
You know that smell, right?
Yeah.
And what you used to do is you rub it on your arms and then you'd wrap your arm in plastic wrap overnight.
Christ.
And have you ever had your hair completely dyed?
Yes. Yeah.
So you know the feeling of bleaching your hair and how it feels like ants are like biting
It
your
feels
scalp.
like it's
your scalp?
burning.
Yes.
Yeah.
That's what it felt like all night. So I'd have to sleep through that. And then I would stop sweating profusely for a while. But I kind of knew even at like 20 when I was trying this out, because it was a friend of mine that recommended it. I was like, this is probably bad.
Yeah.
Right? Like this is probably bad for me. So around that same time, I also start to get jaw pain. And it starts off as like small and like clicks and pops and whatever. And by the time I was in my late 20s, I had headaches every day.
Yeah.
And I'd be taking Advil 2-3 times a day, which is terrible for your stomach.
Oh, awful. Yeah. Hard on the liver and kidneys. Yeah.
Terrible. And so eventually, once I actually started dating Natalie, she was like, somebody did tell me about Botox under my arms. It was probably like my mom or something. And I just never did it. And then Natalie's like, listen, like you should try it. You should try under your arms, whatever. So I tried it and instantaneously it worked. And it works for like 6 to 8 months.
Okay, I was going to say, because
right?
you have to go get it like topped up because it's only like a 6 month thing.
Yeah. So it doesn't last forever. But you know, back in the day, what they used to do was they'd actually like put you out and like snap a nerve or something in your body.
God.
Like there used to be like a thing that people got done, like a serious procedure where they'd have to deflate a lung and get into your spine or whatever. So this is a lot better than that. And then I was like, okay, well that worked on my underarms. And she's like, you should try it. And this woman mentioned it, the masseter Botox thing.
Yeah.
People do it for jaw slimming because what happens is you chew and you bite and you clench and you do whatever you do with your jaw, and you're basically, your muscles get so built up in here. They're some of the strongest in your body.
You ripped jaw.
You get this huge like thing that, anyway, I just did it because my jaw I was in pain all the time.
Well,
every day.
I remember when you started getting it done and then when it was wearing off, because like when we used to sit in the Virgin studio, my eye line was right across to you and I could see you adjusting all the time. And I was like, are you going to go get a touch? You're like, yeah, okay. Because I could tell when it was starting to wear off and you were sore.
Yeah. So
honey.
I've obviously, I've gotten I've been getting it for 3 years now.
You're a Botox girly all over.
I am,
yeah.
but it did. She was right, by the way. The masseter thing is true. Like it sharpened my face immediately. If I'd lost a little more weight, it would have been sharper.
No.
But I'm serious. It was like really, it really noticed a difference. And
super swole. I miss going to shop. You would go to Shoppers often to get your medicated armpit spray. It was no spray. You had a certain deodorant, and we would go together sometimes. And we can't do that anymore now that you're a Botox
I
girly.
tried so many different deodorants, and I ruined so many T-shirts and stuff because they would be so hard on the T-shirts.
We don't know what we know until we know it.
That's
you know?
right. That's right. So
So
it's these Tweakments. You know, I think it's interesting because
do what you need. Yeah.
When you hear, so for me, it's obviously not beauty related.
Yeah.
But I would do it. I just don't know where I would even start. And I think what's interesting is how that conversation has shifted, because there are the way that the older generation sort of views it is, oh, this is sad. You're in your early 20s. You're looking the best you'll ever look, which is, you know, naturally like, for a lot of people, that can be true. Not always.
I looked horrible in my early 20s.
So did I.
Looked
I didn't look great. Like, I'm not going to lie. But you know, you're young and you're youthful and whatever. And if you ask somebody in their 20s now, or you ask our generation in their 30s, they'll tell you, well, this is me taking control of my life and how I look. And I really feel empowered by that.
It's also
so different, right?
Yeah. What you do with your body and how you want to present yourself is nobody's business. And like, that's the thing, is like, if somebody says, well, I'm just, that they don't talk openly about the work they've had done because there's that shame. It's usually the older people judging them, right? Like it's, and I don't think it's, you know, I don't talk to my mom about getting a little bobo in my head because I know that
she will have that reaction.
She will have that reaction, but it's not because she is outwardly like, oh, I hate you, daughter, but because that's the way that the narrative was those days. So it's just a generational mind. However, I don't tell that generation about any work I've done
as my
because
mother
of
likes
that
to say,
mind.
you edit what you tell your parents.
Exactly.
Yeah,
Sorry,
because there's
Mom.
only so
Sorry,
much they
Mom.
can handle.
It's but do what you need. If you need a little flip, if you need a little Botox, do what you need. It's nobody's business.
Yeah. Okay. I like that.